Hello, welcome to our live streaming today event. We are talking about levels of beta-hCG. We are talking about the recommended beta-hCG levels. When we talk about hCG, we are talking about a hormone that is responsible for many changes for pregnancy. hCG in full, actually, it means the human chorionic gonadotropin hormone. This hormone is produced by the placenta. Specifically, there are cells in the placenta. They are called syncytiotrophoblastic cells. These cells produce the hCG hormone, and when this hormone is produced, its work is basically to stimulate the corpus luteum or the corpus luteum to produce a hormone known as progesterone. Progesterone is a hormone that is responsible for maintaining the pregnancy. Let me know if you have any questions in regards to women's health. Gerard Massa is the name of the channel, and today we are talking about the recommended beta-hCG levels. So without further ado, we shall proceed, and we have talked about the recommended beta-hCG levels. So our topic for today is that we need to know the ranges of the beta-hCG levels. The normal ranges should be like this: anything between 25 mil international units per mil and above, we call that the normal ranges of beta-hCG. If at all you go to your doctor and the levels of hCG, your report for the hCG or the pregnancy report comes out, and it shows that your levels are between 5 mil international units and below, then it means you are most likely to be having a negative pregnancy test. If you do the pregnancy test, the blood pregnancy test, and your levels come out and you are between 6 mil international units up to 24 mil international units, then we say you are in the gray area. When we say that you are in the gray area, simply we are talking about you are most likely pregnant, but you just need to wait for at least 2 to 3 days and then repeat the test. You could actually even wait for like 1 week and then repeat the pregnancy test. It can always show that it is positive. If your report for pregnancy comes out and your levels of the beta-hCG is between 25 and above, that means if the report comes out and you have a reading of maybe 100 mil international units per mil, or even like maybe 1,000, or anything above 25 mil international units, then we say you are having a positive pregnancy test. Gerard Massa, the health educator, is the name of the channel, and on this channel we talk about women's health, we talk about reproductive health, and we talk about pregnancy related issues. Ask me all your questions and I will answer all your questions. And in today's live streaming, I'm really so happy to talk to you, my friend. Connect with me, ask me all your questions in regards to women's health, and I will answer all your questions. So we are proceeding. If at all, what happens when you do the pregnancy test and the beta-hCG levels are below 5? This actually means that you are negative for pregnancy, but also it could also be due to the fact that probably you did the pregnancy test very early on, probably you tested too early. Or it could also be due to the fact that maybe the urine was over diluted. Probably you drank lots of water, or even in the container there was some water, and then you just added in the urine. It can give us readings which may not be really good. That is if you're doing the urine pregnancy test. Still, the urine pregnancy test is a pregnancy test, but in this case, it tests for the urine. It tests for the hCG readings or the hCG levels in your urine. So the best advice I will give you today about pregnancy testing is that you need to first of all begin with the urine pregnancy test, and then if it gives results that are not consistent or results that are really not accurate, then you can go ahead and do what we call the blood pregnancy test. We are talking about the recommended beta-hCG levels, and yes, as a summary, we've said that the normal readings are supposed to be 25 mil international units and above. And we have said that the recommended the readings when they are between 5 mil international units and below, then that means that you are actually negative. You are having a negative pregnancy test, and anything between 6 mil international units and 24 mil international units, that means you are in the gray area. So we are proceeding with our topic for today, and we are saying that it is very, very important to go ahead and discuss with your doctor in case you have any questions. And yes, your doctor will explain to you the readings, the hCG readings or your pregnancy test readings. If the readings come out and your doctor notices that the beta-hCG readings are low, but you are showing all the signs of pregnancy, then your doctor will recommend what we call a pelvic ultrasound scan. When we talk of a pelvic ultrasound scan, specifically we are talking about and having images taken of your reproductive system. Specifically, more attention is going to be paid to the uterus to really assess and see what is happening in your uterus. When an ultrasound scan is done, you'll discover that images will be taken of how thick your endometrial stripe is. When we talk of the endometrial stripe, we are talking about that inner lining of your uterus, because we know that the uterus has several layers, but specifically these are divided into three major ones. We have the perimetrium, that is the outer layer, then we have the myometrium, and then we have also the endometrium. So if at all an ultrasound scan is done and inside your uterus there's what we call there's actually a gestational sac that is growing, or there are changes that are happening. For example, there's increase in the thickness, then your doctor will tell you that yes, you are actually having changes taking place, and specifically you could actually be pregnant. So in today's video live streaming, we've talked about beta-hCG, and please let me answer all your questions down below in the comments. Gerard Massa, the health educator, is the name of the channel. Have yourself a fantastic and healthy day, and may God bless us all. See you in my next video. Bye-bye.